mental health touches every family and every community member. I have a lived experience. I have a child with a mental health diagnosis. So I know from my own life how it can be such a wonderful thing to have folks like yourselves and the work that the National Alliance on Mental Illness does for our community. So we offer many things. So with that lived experience, I just want to say thank you to all of you. Now, I may not have worked with any of you. I live in Chelan County, so probably not. But I want to thank you for the work that you do every single day. It's not easy. It takes a lot of work to do and a lot of passion on your part. So the National Alliance on Mental Illness is a grassroots organization, and I love sharing this picture. It's a messy kitchen. It was founded in the 1970s by some families around the breakfast table trying to figure out how do we take care of our children who are struggling with mental illness. What do we do? When you think about it, and maybe some of you weren't born in the 1970s, but there were not a lot of services available. And now look at this room, right? Isn't that incredible? Give yourself a little hand clap there. There are so many services that are available. But NAMI was founded on this principle of people helping people that understand what it's like to deal with a mental illness. We're dedicated to building better lives for millions of Americans affected by mental illness. And one of the things that I discovered when I first met NAMI, and that's how I package it, I met NAMI back in 2018 on my academic journey. I discovered that the World Health Organization, it was 2015, the report that I read, said that by 2030, depression will be the #1 global health burden. That was very impactful to me as a nurse. Number one, having never heard of NAMI at the time, and taking my first dive into mental health as a nurse, I'm a little embarrassed that I hadn't spent more time there. Talk to your doctors about their education on nutrition. It's also like this big. But really looking at what the World Health Organization was saying about that global burden that was coming. And I think if we look around at our country, at our state, at our region, that it is the #1 burden. It is the #1 thing that we all need to be focused in upon. So NAMI has doubled its efforts, and it's bringing evidence-based programs, which that speaks to the science in me, the nurse in me. I love evidence-based programs. I'm sure some of you could raise your hands to the programs that you offer as well. But those programs are designed to do what? To stop stigma. The stigma of mental illness is an incredible barrier to folks seeking help or sharing about their own experiences. And quite honestly, in those early days for me, in 2018, 2019, I'm not biased. I don't have any stigma against people with mental health disorders. I mean, I have a child with a diagnosis. I struggle. And doggone it, did you discover any of your own biases when you were diving in? I absolutely had biases. I absolutely had a significant amount of stigma. Didn't want to talk about my child's diagnosis. Didn't want to talk about what was working for us. But having a better understanding of how the evidence has opened up the thought of peer-to-peer sharing and family sharing what they're going through is certainly incredible. NAMI has many programs and services. You're so lucky I won't be talking about all of them today. But I will share with you that we are passionate about all that we do. We have many activities like our NAMI Walk that's coming up. I will talk a little bit about that for you. But we have many activities that we do. In fact, last month we were in Olympia representing all of you because we cover a 4-county region. And we're speaking to our legislators. We missed Senator Dent, of course, but we'll get with him next time. Okay, I have a mouse that has a mind of its own, everyone, so bear with me. It's still speaking on its own. Okay, so NAMI North Central Washington, we're part of a national alliance. There are more than 650 affiliates across 49 states. I'm not sure if you have heard of NAMI before this morning, but I can tell you that it was a surprise to me as a healthcare provider, not knowing about NAMI many years ago. So if you haven't heard of us, don't feel bad. Many people, and I just talked to someone the other day that wants to volunteer for us that had never heard of NAMI. Come on, I'll tell you all about it. We're currently serving Chelan, which is where I live, Douglas County. Grant County is one of the newest counties into our catchment area. I think we added Grant County 2 years ago, and we've been working to try to make a name in this little area, attending conferences and other sessions to share about the support services. We've met with the libraries in town, and we're really looking for a space to provide peer-to-peer support groups as well as family support groups. We have anti-stigma work that we do. Again, the NAMI Walk is a big part of that awareness campaign that we do, and you're going to have to bear with me if this mouse is not it's not appearing on the screen, so it's hard to function. I might get my hand on it. Let's see. It's going to keep changing the page instead of showing you the other. So we're always looking for more hands and hearts at our affiliate to serve. And I know that being in Grant County, that might be a little bit more challenging with the distance between here and Chelan, where our main focus is at, started about 17 years ago. But we are advancing into these areas. We have 2 members and volunteers that serve this community, and we're looking to expand that. We might have a pop-up walk in May, so keep your eyes open for that. We're so excited for the work that's coming. When you think about the pandemic and how it affected all of us, all of our services were all in person, as I'm sure yours are too, and we had to switch gears and go into a virtual mode for those years, and we never stopped providing, and I would love to say that I was responsible for any of that, but I was not, but we never stopped providing those family support groups and those peer-to-peer support groups, and that was vital. I don't know if any of you experienced any mental health challenges during the pandemic. I almost quit my doctorate program. I almost quit my job. I almost went into a shell because it was just overwhelming in the healthcare system and the healthcare sector. Okay, so let's shift gears just a little bit. I want to see if you'll bear with me and you'll let stigma not stop you from sharing, if you would be willing to raise your hand if you have been personally affected by mental health. And that's how I would package it this morning. So many. Thank you so much for sharing that. How about others in the room, or maybe also the same folks like myself, have a family member that's struggling with mental health challenge? And of course, every single person, every hand in this room, if they can hear my voice, they should be raising their hand right now. Our community is impacted by mental health. All communities, right? We are dealing with it. We would love to not be dealing with it, but here we are dealing with it every single day. It's a simple question, have you been affected? But it really tells us that we are more connected in what we're doing and our experiences than anything else around mental health. We know the journey and the pursuit is not something that we do in a silo or in a vacuum. We have to come together for events just like this one to do that work. So thank you so much for sharing. Oh, this is so nice. It actually works. Yay, thank you for whoever did that. Mental health is a part of being. It's not a problem population, folks. Can I get an amen from the back? Okay. So it is about being human. It really is. Stress, loss, change, transitions, illness, recovery, all of those things are a part of life, and all of those things can impact our mental health. Every single one of them. Wow. Illness and recovery, that speaks to my area as a nurse. It is definitely an area that as I've progressed on your journey, no matter where you're at, what you're learning, that you are ready to keep that going. There's not a stopping point. There's not a degree or a certificate. I'm now done. I'm finished. I'm all ready to go. I've learned everything that I can learn. I'm sure that you can agree that if we normalize these types of conversations, especially about the stigma of mental illness, that we're going to make this community a better place for all of us. Okay. Oh, I might ruffle some feathers in the room. Some of you are a little young, and that's okay. I love that. But the term cultural competence was what was taught to me in my nursing program. We must be culturally competent. We must focus in on serving the needs of the people that are in cultures that are different than our own. Well, that's wonderful. I love that in theory, but I think I have a little problem with what those folks were telling me. Number one, let me share this definition with you. One health education organization defines cultural competence as the ability of an individual to understand, respect values, attitudes, beliefs, and more that differ across cultures, and to consider those things when you're designing programs, health education, promotion programs, so that it best serves that culture, right? Great. How much time do I need to learn someone else's culture? Anyone? Go ahead. A lifetime. Oh my gosh, this class is brilliant. I would agree. It's not something that you can quickly do. Do we try? Are we trying as hard and as fast as we can? Absolutely. But it takes a lifetime. And I think that lifelong process is so important for us to have an understanding that we can make a difference, but it's really about how you approach it. So I know that you might be wondering, how did I come to this brilliant conclusion? We must have cultural humility, not cultural competence. I spent a decade traveling from country to country with nursing students, learning about the culture of the land, learning about the healthcare system, learning about the role of the nurse, which, are there any nurses in the room here today? Yay! Oh yay, my friends, my people, yay! As a nurse, you'll be happy to hear that nursing, the identity of a nurse, no matter what country you go to around the globe, is the same. We all want to care for you. Our goal is caring, and that encompasses quite a lot, I'd say, caring, right? So after spending time in, oh goodness, Panama, Spain, South Korea, Argentina, Ecuador, everyone asked me if I speak Spanish. I said, which dialect would you like? No, I can't speak that one. But I can understand quite a bit. So that's the good news about my travels. Sadly, I've not arrived at cultural competence. And it's not for a lack of trying, definitely tried. And I hope that you can see there's no way to master someone else's culture. There's no way to do that. What we can do is we can practice cultural humility. We can listen deeply. We can pause. We can all understand that we're on this journey of cultural humility. And I mean, maybe someone will master it. Maybe yoga, right? Maybe one day. What I would like to do next is turn this over to you. I would like to ask you to take a couple of minutes to talk with the people at your table, and if there's only a couple of people at your table, move around a little bit. And I want you to share with one another how you practice cultural humility as I've kind of described it this morning. What has worked well for you, or what aha moments have you had? I really am hoping that we can come up with some great ideas to inform one another. I'm always looking for more tips on how to approach other cultures in a humble way. So let's just take a couple of minutes to chat amongst yourselves, and I'll give you a ding dong or something, I don't know what I'll do, to stop you, but take a few moments to share what works for you. How do you approach cultural humility? And then I'll ask for a few people to share.
Yeah. Trio for bad. regularly in the day. So we serve chicken new. Not to be afraid of.
I was like, this, I never heard of this. I mean, looking at the,
Yeah.
I feel like so I don't know if you
I think for me, it's probably like that learning. I mean, listening. With like the work I do right now, just listening to what have to me. Because it just listening. The big thing that and right now in our work, we're like creating personal statements for students and personal statements are like scholarships, colleges, and it revolves around how to grade and things like that. So whenever I meet with a student and we go over,
We'll take about 20 more seconds. Wrap up.
I either try to connect with them, so like when they share something from their culture, I say like, hey, that's interesting, or like that's awesome, tell me more about it. Because growing up, I also wanted someone to ask me, or like ask more questions. So like, for example, like 2 days ago, one of my students was writing about how like he felt ashamed, and I was like, hey, I tried to communicate like, hey, that's awesome, right? That's awesome. You don't feel ashamed of that anymore. That's what being curious and sharing some of my own that I can relate to that.
Okay, let's bring it back in, everyone. Thank you so much. It looks like we've had some really healthy discussions here. I'm excited to hear what you have discovered. Any tips? I'm really hoping that I can get a few people to volunteer to share something that they learned from one of their table mates. Anyone? Teresa.
I always love that when I meet somebody from another place, they go, have you ever had my food? And I'm like, Polish food. I want a Polish hot dog. And they're like, that doesn't make it Polish.
Oh, I love that. Thank you so much for sharing that. Food, I think we can all get around food really easily. Any others? Please. You didn't learn anything today from your table mates. Oh, thank you so much. Thank you. What she was sharing was that taking a moment to really just kind of self-evaluate what are my biases, and then just taking the time to learn and listen
up front, like, I don't know much about your culture, and I would like to learn, and then you could ask questions and it'd be from a sincere place instead of questioning type, tactic.
Yes, that's wonderful. I agree. The humility of approaching someone, saying that you really have that true curiosity to learn more about their culture is really of great value. My table mate shared with me that they ask about family traditions so that they can learn a little bit more about their culture. And some in this room might raise their hand high that they would love to share about their family, and there might be others that not so much, not a fun topic. So talking about traditions maybe is more of a safe space than talking about your family. So great tips. Thank you so much. I hope that discussion kind of resonated with you, helps you to get a little bit more specific on how can I be more culturally humble, how can I learn more about others, and keep myself open to learning, because it's not a one and done. Oh, I got it. I know that culture now, I'm good to go. Nope. You're like, no, you're good to go. Hit the road. You've got a lot more learning to do, man. Okay, so let's shift gears a little bit. This one's kind of fun. Oh, no, take mine. Oh, is it on? Testing, 1, 2, no, it's not on. Well, that will be testing. It's on. Okay, so what I would like to do is imagine that we are on a huge jetliner. Isn't this lovely seating for a jetliner? Isn't it? You've got a table, you can stretch out, it's perfect. But I want you to imagine yourself on a jetliner. And I want you to see yourself, let's go to somewhere wonderful. Where shall we go? Warm, somewhere warm.
Bora Bora.
Maui and Bora Bora. We're going to stop in Maui. Isn't that classic, right? And then we'll take the plane on to Bora Bora. So we'll drop some folks off and we'll keep on going. But when you get on the plane, and I'm sure you have, you can recall that whether you saw it on television or on your last flight, that our flight attendant will go through the safety features on the plane, right? I hope you pay attention. I just look at them, even though I can probably recite their speech, because I have to fly to work out of state all the time. But they're telling us about the exits, they're here, they're there, there's some over the wings. These will float. Please don't let me use those ones that are going to float over the wings. Just tell me about them. Where your life vest is, right? And if the cabin loses pressure, does that make you think of anything else? If the cabin loses pressure, what will happen? The oxygen masks will drop down, and you will get your mask, you'll put it on, you'll get it safely in place before you begin helping someone next to you that might need assistance with their mask. So how much more true is that in the work that you do every day? And I don't care where you work. Please, if the pressure in the cabin changes, put your mask on. Take a couple of big, deep breaths of oxygen, right? Because we can really use it, right? And then start stepping out, whatever that is, that crisis is that you need to approach. Because honestly, if the pressure changed in the cabin of the airplane, they say it does happen. I've never seen it happen. But it's usually just that, and everything is fine, and the flight goes on as usual. Wouldn't that be lovely to put into our workplace when a crisis happens? We put on our oxygen, we deal with that crisis, and everything just goes on. I would say usual. There's no normal. There's no normal. You have any normal in your life? I don't. So, but things would just go on as usual. So I think that if we'll pause and take the time to put on that oxygen mask, get our self in a safe and ready place to help others, we will be doing so well. Prioritizing self-care and wellness it's a message that never gets old. And in fact, it's truer today than when it was coined. And maybe some of you know this, maybe not, but in the 1950s, self-care was coined by the healthcare industry. because we wanted our patients to please think about taking care of their health, whether it's their blood pressure, their diabetes, or others, while they're at home and before they come to the hospital, so that hopefully they don't come to the hospital as often. So we still need to be teaching that mantra. But self-care, it's just timeless. It's truer today than at that point. And so I really want you to think about, filling your cup so that you have space to pour out. You're pouring out all the time. I know I do in my work as a nurse, my work as a teacher, my work as a grandmother, as a mother. We're always pouring out to others, and we need to take the time to fill that cup so we are prepared and on the ready for that next piece. Okay, so let me see. Brad, do I hold this button for the volume? Do I have to hold the button?
No, click it once.
There it is. Okay. So during this next piece, what I'm going to do is walk you through box breathing. How many in the room have done box breathing before?
Oh, Bethany, it's going.
Oh, for goodness sakes. That's not that thing. Okay. Great. Good. So we have some professional box breathers here. Wonderful. So this is just a simple technique that you can use to slow down, to get yourself centered, and to share a little bit about what box breathing does. According to the Cleveland Clinic, gotta get my references, sorry, my scientific side here. Box breathing helps to reduce stress and and anxiety, if you ever experienced that. It activates the parasympathetic side of our system. That's the rest and digest part of your body. And so if we activate the rest and digest, we are actually countering the fight and flight part of our system. So by doing the box breathing, you're actually forcing a slow and consistent pace of breathing and holding your breath and breathing, holding. And at this little video, which I hope you'll join me with, it will walk us through that process. I love to see everyone doing your box breathing. You don't have to be silly like me because I usually raise my arms. But this is something you can do no matter where you're at. So you're going to exhale, inhale for 4 counts, hold it for 4 counts, inhale for 4 counts, exhale, and then start again. So here we go. Inhale, hold, pause, exhale, that simple technique can be done anywhere. You can do it with your eyes open, you can do it with your eyes closed. I think I have to close my eyes a couple times because that's my norm, is I will close my eyes to do my box breathing. But you can do it anywhere. You can do it in the car before you get home from work, in the driveway, before you go into the house to face whatever is there. You can do it at lunch if you've had a tough morning. You can do it before something exciting like being a keynote speaker. You can try. But it really is a technique that you can use at any time. And for those of us that have awareness, if you're working with someone and they seem like they might be in need of doing some box breathing, why don't you recommend, let's breathe together for just a couple of minutes. Let's just take a couple of minutes to do some slow breathing, and then let's talk about it a little bit more, right? Because sometimes things get a little amped up, and we want to bring it back down to center. So the box breathing is a wonderful technique. I absolutely love it, and thank you to all of you that did a little breathing exercise with me. I really do appreciate it. So we've shared a lot about self-care this morning and how it's so vital. It keeps us steady and it helps us to be able to show up for others. I'm going to remind you, self-care helps you to show up for So show up for yourself first. We think about self-care in community work. I invite us to see it not as an indulgence, a fancy extra, right? But as a commitment. That commitment is to ourselves, it's to our family, it's to the community that we serve. And the work you do is so meaningful, and it often is demanding. I know mine is, on many levels, all around. So sustaining our work through self-care requires attention. You need to be intentional about this. And I don't want to cause you any stress thinking about being intentional about your self-care, right? Because that's a real thing. I gotta do the thing. They told me I've got to do the self-care thing. But I do want you to think about how it can help you to protect your energy. It can help you to continue to show up and show compassion and purpose over time in the work that you do. Self-care is how we nurture our well-being, and it's more than just mental. It can also go into the emotional and physical health piece, helping us to build resilience. Not the kind of resilience that tells you to just push through, plow through, no matter how you're feeling. Not that resilience. How many have been taught that resilience before? Yeah, thank you. Thank you for the honest folks in the crowd. Sorry, I wasn't meaning more being honest, but you know, thanks for sharing. Perhaps the most powerful thing about self-care is that it's an act of leadership. Showing others that you are prioritizing your own well-being, you're modeling what limits look like, how we can value our health and our mental health, and that's a choice. You're choosing sustainability of yourself by conducting yourself care. So this example matters for you bosses in the crowd. I love this, is so good. All of you bosses in the crowd, be gentle, make space, understand the reason that we want self-care to be a priority is so that your crew can continue to be effective in the work that they do every single day. So refresh, maybe remind yourself and your crew that that's okay, but it gives us permission to have conversations about self-care. We can remind each other that self-caring is vital and that it's not separate from serving our community. It's the heart of what we do. So we're caring for others, we have to care for ourselves first. I actually tell new mothers, because mother baby is my primary field of nursing, that you have to take care of yourself first. The baby's going to be cared for, but you have to care for yourself first, or else you are going to run out of steam, or have a breakdown, or experience a lot of anxiety or depression. And that's not something that our new mothers to experience, right? So they have to care for themselves. And so it's no different from the work that we do. We have to take time to take care of ourselves. Is it an every single day thing? For some, absolutely. Exercise, that's self-care. Getting out into nature, I was talking with one of my table mates. She's a grounder, just like me. Shoes and socks off, get on the ground. Grass, dirt, rocks, river, lake, ocean, doesn't matter. Just want to put my feet on the ground. So if you see me walking around outside in the grass there, that's what I'm doing, grounding. So again, we want to make sure that we're giving one another and ourselves permission for this work. So for this next step, I want to take us into just kind of another time of sharing amongst yourselves. I would like to hear you share with one another about what you do to kind of balance yourself. Not when things are overwhelming, but when things are approaching that level. And I also want to acknowledge that some in this room, while they might be looking like everything's fine, I'm fine, you're fine, we're all fine, they might be experiencing overwhelm. So this sharing is really vital. I want you to just kind of focus in and share on what you do to make that shift from I'm approaching overwhelm or I'm in overwhelm and this is how I'm going to navigate around it. So I'm going to give you a couple of minutes to, it might be 3 minutes. You guys were very chatty last time, which is wonderful. But I want you to discuss amongst yourselves what helps you to stay balanced? What do you do when you're beginning to feel overwhelmed? And then, of course, I would love to learn from you. Yeah. Go right ahead.
And I think that as soon as I started realizing like all about me and how are you very big people go outside, get air, like walk it out, talking now, I've had I feel the right, the behind, structure, that's what I like in the workspace. When I think start to get a little angry, I kind of take a step back and I start to acknowledge what's overwhelming me. And it's sometimes like I'm a person that being intended, but I need to get them to be able to check when I already find that makes me just get to see that question what I can do next. And I'm home, like be in my room, not on my phone, no noise, just kind of sitting, close my eyes for 3 minutes, and then just like I'm same thing like what you were doing. First acknowledging that you're hearing me and seeing what I can do. If there's like an action plan I need to do, something I need to get done, I'm not going to get that overall sense of me. But yeah, just make it. Like I share with my coworkers, and by stating it, like it just relieves pressure. Like I'm not sure if I saw it on a TV show, but like couples are like shared, and then like when you share joy, it's multiplied and something like that. And lately it's been like exercising. And I just put on a TV show that like I used to watch when I was a teenager. And like after the workout, like, I feel good. I'm like, okay, like, I feel my body moving. And those are the two things that I do. Horrible at taking care of yourself. Cereal, you know, that's how bad I am. And I know I'm not that, but now I can realize, that's Netflix rock, like reality show or something.
Okay, 20 more seconds.
That's what I'm like. I'm gonna find out reset.
Okay, everyone, let's come back together, please. Let's come back together. I think Teresa was about to do one clap if you can hear me right now. Love that, love that. I was just at the cafe ribbon cutting ceremony the other night, and that was one of the things they did to get everyone's attention before the little girls did their dances for us. It was a wonderful experience. Was that just 2 nights ago? It was wonderful. So let's take a couple of moments here to share. If you would, you can share something that a table mate shared with you as far as what do you do that really works or is effective? What have you found that helps? Oh, thank you.
So,
generally I can rotate when things get hot to different spots. I was in a unique situation last year where it was like, oh, okay, I got all these things going on here, there, everywhere. And so I do a lot of working out in the gym and that helps, but something I found that really helped me was I would stop at the Okanagan River in Park and I would watch the current of the water for about 15 or 20 minutes. And I started to notice that would rob me of some of my anxiety. And then for some reason, the flow of the current, watching the water, it was like therapy. It would slow my mind.
Listen closely, everyone. This is genius right here.
So it would slow my mind down a little bit, and then it would put me in a spot where I could perceive things a little bit differently. It would put me in a spot where I could challenge myself to look at things or take things in a little differently, and then, you know, my solutions, the things that I would be in a different state of mind to create solutions. So that water therapy, I started looking it up. Sounds of water, ions, negative ions, and stuff like that. Very therapeutic. So if anybody's, I highly recommend it.
Absolutely, that's genius. Thank you so much. There is a lot of literature on water and also really, really old literature. If you have high blood pressure, to get a fish tank or a screensaver with fish on it and watch it for about 15 minutes. It can help to lower your blood pressure by 10 to 15 points. So that's also very helpful. I love the water. And then take your shoes and socks off and get on the ground. Any other thoughts to share in the back?
I can't follow that, but I found for myself, because in the moment, sometimes I can't just go out and take a walk. Sometimes it's a little awkward to just stop and start breathing. And so when I'm feeling overwhelmed in a moment, sometimes I just stop. What's my purpose? What's my priority? And that'll kind of recenter me to not going down a rabbit hole or not just jumping off of what I'm feeling or thinking, but really just like, okay, what's my purpose and what is the priority of what I need to get done right now? And just singling out that so I don't feel all these other things that I've got to do throughout the day or the next 20 minutes and just picking one and kind of going that direction.
That's ideal. Really just kind of bringing us back to our why. Why am I in this space? Why am I doing this work? What is my purpose in this work? That's wonderful. Thank you so much for sharing that.
Laura shared with me how she works in business and music, rock and roll, very loud.
Dance? Dance? Yeah, dance.
Reading, getting her feet wet and hands, dirty, gardening, reading.
Nice. Great. I love that. Getting outside. I love the get your feet wet, get your hands dirty. Right? Do something productive, right? Shift your mindset. That's wonderful. Thank you so much for, I'm sure there's so many others out there. I'd love to hear more, but we don't have that much time. So I really do appreciate you sharing with one another. I hope you learned something new to try. I certainly have learned quite a few. I love the Columbia is my river. I could love to go sit there and watch the water too. But let's refocus on the work of the day. This day is about the collective impact that you have, that we have, right? Every person in this room matters for the work that we do. And I encourage you to learn together today, continue to do that, connect with one another in meaningful ways, and to reduce stigma, the bias that limits our work. Let's really work on getting those things shifted. I encourage you, I hope the activities of the day are supportive to you personally, not just the work that you do, but to you as an individual, and then you can carry that away. And of course, I have to do a plug for NAMI, North Central Washington. We do need volunteers in Grant County. We would love to have you. I have a table in the back that's been unmanned, right? But I'll be there. So come by and see me. Thanks so much for showing up. Thank you for being here, for yourself, for your families, and for our community. It's really been a privilege to be able to chat with you today and share. I really appreciate all of your attention, and I'm really grateful for the time to share with everyone. I'm just going to pop the QRs up for my affiliate and for our NAMI walk. If you want to join us, you're welcome to. Thank you so much, everyone. I saw 30 slides. Okay, can we just get one more round of applause for Bethany? Sara Bates with Thriving Together is up now to share a little bit with us about today's focus of vital conditions, and then a really cool data tool that she has helped build so that data has accessibility all across our North Central Washington region. So I won't spoil it for you, so I'll send it to you guys.
Thank you, Erin. And thank you, Bethany, for a wonderful introduction to today's work. Behavioral health would usually fit under the vital condition of basic needs for health and safety. I think we all can see how that fits together, that in order to feel like you have everything that you need for health and safety, you probably need to have behavioral health, mental health, feel secure. But I want to have you guys think about how behavioral health really fits in almost every single one of these vital conditions. From belonging and civic muscle, knowing and feeling that you belong can have a huge impact on mental health. Having meaningful work and wealth, again, when you have a stable job, income, it can really help improve some of those mental health issues. Having lifelong learning, being curious, knowing that there's so much still to learn is another really great thing to think about. Having reliable transportation, feeling like you aren't stuck in a certain place, but knowing you can go and reach the resources that you need. Humane housing, of course, is a huge impact on behavioral health. And of course, as Bethany was really saying, thriving natural world, having spaces to get outside, get your feet dirty, and get your feet wet in rivers and lakes and things. So I just really want you all to think, yes, today's focus is probably basic needs for health and safety, but the vital conditions, those things that we all need in order to thrive, really can be seen throughout each and every one of them. So at Thriving Together, we use a tool called IP3 Assess. And basically, IP3 has a framework specifically for the vital conditions, allowing us to look at indicators for each vital condition and be able to measure how we are doing as a region, as a county. Many of the indicators can be broken down into zip code or census tract. But I'm going to show you how I use it in producing reports for different organizations, different topics. So for today, you can see I've created a report for today's gathering because we are all here together. And for me, in looking at data, one resource isn't enough. I want to have resources that are local, that are state, that are national, to broaden our view of the topic. So you'll see in today's report, which I believe will be up on the CHI's website following today. All right. So a quick overview of behavioral health, and then I've broken down behavioral health into 3 topics. So just a quick overview, really looking deeply at Narcan, recovery, and anti-stigma, and then the focus on youth, suicide, and substance use. I'll also be collecting additional resources that you hear in today's speakers so that you can have one place to go to find all of this information. And then just a quick plug for well-being and measuring well-being. In 2024, we did a well-being survey of our region, and these are the numbers for Grant County. So 49% say that they're thriving, but that means that over 50% say they're struggling or suffering. And so that's where we want to focus our attention. How do we make sure that everyone in every place feels that they are thriving? So you can also break it down a little bit more to focus our attention and our work. So I'm going to just scroll back up really quick and just give you a quick peek at each of these 3 sections. So you can see in these 2 graphs that the number of mental health care providers is much lower than the state benchmark. And the frequent mental distress experienced in Grant County is above the state benchmark. So that kind of correlates there a little bit. And you can see in this map that frequent mental distress is not equally distributed in Grant County. There are pockets that have higher mental distress. So there's great data and information out there in the Grant County Community Health Assessment and solutions and ideas in their CHIP, which the Grant County CHI has been so great in participating in. Chelan Douglas Health District has also worked with Grant County Health District to produce a behavioral health dashboard. So there's a link to that. And then Thriving Together actually took that work of the behavioral health dashboard and expanded it into really asking users of behavioral health services what is good about those services or what might be preventing them from using those services. And so there's a great report also on that here. And I wanted to just really point out again that behavioral health is not just a basic needs for health and safety issue. Here you can see how belonging, civic muscle, humane housing, those indicators really do matter in this topic. So, go back. And I'll just give you a quick peek here at the Narcan recovery and anti-stigma in Grant County. So Thriving Together has been very lucky to work with Carillon in providing free Narcan vending machines throughout our region, including here in Grant County. And so you can see here Caroline has a beautiful dashboard showing just how much Narcan has been distributed. So 10,000 boxes, so that's 2 doses per box, throughout our region has been distributed. You can also check out, we have a dashboard on our website showing where that Narcan is actually being distributed, why it's being distributed. A lot of people want to just make sure they have it on hand, or they live with someone who they fear might overdose. Huge shout out to the recovery coaches and Noki Pando for sure, who's working in Samaritan Emergency Department, making sure that those who are looking for resources for recovery have them right away when they need it. And then there's some really great anti-stigma campaigns here and throughout the state. I encourage everyone to watch the videos. So, okay. Last but not least, some youth suicide and substance use resources. And looking at where those pockets of children who are living in poverty, where we can start right away, making a difference in those youth, their young lives. Another great resource for data and understanding the issue is the Healthy Youth Survey. So I encourage you to check that out. Okanagan County and the Colville Confederate Tribes are starting a North Star initiative that's all about talking with youth and finding out their solutions. And so we're super excited to see the progress in that program. Renew has fantastic youth programs, so there's some great things to check out there. And then lots of resources for talking about substance use and suicide prevention with our youth. So, all right, I hope you all check it out. Again, it should be on the website, and I hope that it helps to provide the data and resources that you all might need as we work together to solve this issue. So thank you so much.
Okay, as Sarah, whoa, we're way farther off the slides than we should be. As Sarah mentioned, it's not lunch yet, I'm so sorry. We will have on the CHI website. It's under like very heavy construction. I have hammers and nails and I'm working on it very quickly for you all, but that will live on our website. Now, has anybody heard of the new behavioral health program here at Big Bend? Raise your hand. Okay, not enough of you. So I'm going to bring Tiffany Morris on stage. She's going to share with you a little bit about that program before we go on a quick break. So come on up, Tiffany.
Hello everyone, thank you for allowing me to be here today. My name is Tiffany Morris and I am the program specialist for our Bachelor's in Applied Science programs here at Big Bend. Today I'm really here to talk about our behavioral health program. It is a new program here for Big Bend. We launched this last fall of 2025, so we are in our first year of the program and have recently opened up applications for potential students for our cohort number 2, which will start this coming fall. This program is a partnership between Wenatchee Valley College and Big Bend. So each cohort consists of 30 students, 15 from the Wenatchee Valley College Service District and 15 from Big Bend Service District. Like I said, this program is an applied science program. It's really driven by the local demand for bachelor educated professionals in our community. This is considered a 2+2 degree, so it builds on an associate degree by adding junior and senior level courses in things like case management, advanced counseling, and psychology of addiction and recovery. So a lot of opportunities for students to be able to be kind of hands-on in these different fields. The classes for this program are considered hybrid. So they, in their first year, are online classes, but we do have 3 required each quarter experiential workshops. They are 3 Fridays per quarter. One will be hosted here at Big Bend Community College, one at Wenatchee Valley, and one at OMAC. So these are in person. If you are the student within the Big Bend Service District, we would like you to come to these workshops, but they are required. So if you can't come in person, then we also offer them over Zoom. This really allows our students to be able to work on case studies and things like that, and just really get that hands-on experience. So with that being said, the second year of our program, this is where that more hybrid sense fits in. We have, each student is required to do at least 240 practicum hours. So the last 3 quarters in the program consists of those practicums, and that those hours really align with the new behavioral health support specialist certificate that came out, or credential, that started in January of 2025. So with that alignment, by allowing students to get those hands-on hours, and then at the completion of the program, they would complete an ethics and law exam to be able to receive that behavioral health support specialist credential. Students who have this credential are certified to deliver brief, evidence-informed interventions under the supervision of a credentialed provider. So they wouldn't be able to diagnose, but they are able to allow for interventions, which is a really great opportunity for many, many organizations. If you are a provider who is interested in kind of seeing how this might help in your organization, we're happy to meet with you and talk about it. And then if you are a potential student or know of somebody who might be interested in the program, it's such a great opportunity for our community to be able to allow this, where we're kind of building our own, essentially. If you are a provider and would like information on this behavioral health support specialist, UW is having a luncheon here at Big Bend Community College on April 16th. Many of you might have already signed up or received invitations, but if you haven't and you are interested in doing this, if you want to meet me, I'm tabling in the back. I'm happy to take your information so we can send out that information to you. RSVPs are open through April 1st, so happy to meet with you, talk about the program, how we might be able to help, and then if you are a provider who's willing to host one of our practicum students, that would be an awesome opportunity to partner. So please, please, please meet me in the back if you have any questions or are willing to help. Okay, thank you.